Hi. A lot of couples have questions and concerns, especially when they want to start their pregnancy journey, and also what to do to have a healthy baby and a complication-free pregnancy. Hey guys, you are welcome back to my channel. If you are just joining us for the first time, I am the Vogue Nurse, Okeke Jennifer, and you are welcome back to my channel. If you've not subscribed to my channel, please subscribe by hitting the subscribe button and also turn on your notifications so whenever I drop a new video, you'll be the first to get the hits. Now, if you are planning to get pregnant soonest, or you are a couple that have concerns about pregnancy or what you should do to have a healthy baby and a complication-free pregnancy, stay with me on this video. Now, on this video, I'm going to be sharing with you 8 things that you can do while you plan to get pregnant. What I mean is what you can be doing while you wait or you try to conceive. Now, before we talk about things you can do to have a complication-free pregnancy, let's talk about why you need to do these things. Everybody wants to have a complication-free pregnancy. You are doing these things in order to stay away from complications like neural tube defects for your baby, obstructed labor during your delivery and all. It is important that we pay attention to what gets into our body, the things we eat, in order to have a complication-free pregnancy. Now, here are 8 things you can do while you plan to get pregnant in order to have a healthy pregnancy and a healthy baby. Number 1, start a folic acid therapy. Now, folic acid is an essential nutrient that the body needs in order to form a baby. Now, during the early formative stage of a baby, the body needs folic acid, especially during forming the brain and the spinal cord. It is important that a woman who is planning to get pregnant takes about 400 micrograms of folic acid every day in order to get the required dose for your baby during formation. Folic acid can also be gotten from basic food that we eat, like vegetables, eggs, and so on. It is important that you pay attention to foods that are rich in folic acid and also take folic acid supplements. Number 2, stop excessive drinking, smoking, and use of illicit drugs. We all know that all these that I've mentioned have a tendency of causing toxins into the body. Now, these toxins in turn change the DNA of the baby and can cause defects, abnormalities, complications in the child, abnormal features you're likely to see when the baby is born. Also, cigarettes has a way of causing preterm babies, babies with low birth weight, or babies that are small for age after they've been delivered. It is important to know that these toxins are not healthy for us at any point of your pregnancy and should be reduced, if not completely eradicated from our system during pregnancy. Thirdly, eat healthy. We cannot overemphasize on the need to eat healthy, especially giving your body the required nutrients that it needs, both in macro and micro quantities. It is important that you eat healthy foods that are rich in nutrients that the body needs on a daily basis. Foods like carbohydrate, protein, vitamins, minerals, water. And yes, I said plenty of water because your body needs to detoxify. So here's number 4. Cut down on caffeine consumption. Caffeine, by research, has the tendency to cause a lot of miscarriages in pregnant women, even though caffeine is consumed by the spouse. It has a tendency of causing miscarriages in women of childbearing age. So, the need to cut down on caffeine or completely take it off your system during pregnancy, or if you're planning to have a pregnancy. Now, here's number 5. Do a weight check. Now, we all know that there are 2 kinds of weights that can be of concern to anybody or any individual. It's either you're overweight or you're underweight. Now, both of them are not good for you, especially if you're planning to have a baby. These conditions can cause you to have a lot of hormonal imbalances, causing fertility problems for you and your spouse. Now, if you're overweight, you're prone to having conditions like gestational diabetes, which can in turn cause you to have macrosomic babies. That will be babies that are so large for you to push out when you're at term. So please do a weight check. Now here's number 6, exercise more. Now we cannot overemphasize on the need to exercise. Exercise helps to tone muscles and keeps you fit. Muscles like your abdominal muscles, your pelvic floor muscles, and the muscles of your legs need to be strong enough to bear the pregnancy. So exercise is very important for you and for your growing baby. Now number 7, vaccinate. Now before pregnancy, it is important that every woman gets vaccinated of tetanus, diphtheria, pertussis, also measles, mumps, and rubella, to be able to protect your growing child in the womb. It is important that you get vaccinated or talk to your doctor to know what vaccines are safe for you to take at what point during your pregnancy or before you complete your pregnancy plan. Now finally, number 8, get tested for STIs. We cannot overemphasize on the dangers that sexually transmitted infections can cause to yourself and your growing baby. It is important that you get tested to know what is going on and also treat early before you get pregnant. Sexually transmitted infections such as syphilis can cause miscarriages through your pregnancy, and that won't be good for you. Also, infections like HIV, it is important that you know your status early in order for you to start treatment in order to protect your growing baby. So please get tested for sexually transmitted infections. Now, I would like to wrap this up by saying, if you have long-term conditions such as diabetes, hypertension, or even cancer, and you're planning to have a baby, it is important that you speak to your doctor in case you are taking any medications that can be harmful to your growing baby, to know if you can swap with some other medications or reduce the dosage in order to have a pregnancy that is free from complications. I'm your girl, the Vognus. Thank you for watching. Don't forget to like, subscribe, and also share this video because you do not know who this video could be helpful to. Next time on another video, I'll see you.